Welcome to Stem Cell Genius, powered by R3 Stem Cell. I'm your host, Samantha Breckner, president at R3, and each episode, I sit down with our founder and CEO, Dr. David Green, to answer your most pressing questions about regenerative medicine. From stem cells, exosomes, and PRP to the latest breakthroughs in treatment and science, we're cutting through the noise and giving you real answers from one of the world's leading experts. This is Stem Cell Genius, your front row seat to the future of regenerative medicine. Thank you, everyone, for joining our third episode today of Stem Cell Genius. Today, we're going to get into what do stem cells actually do, and then let's talk about how they play a role in the top 5 conditions that we treat. So, Dr. Green, could you tell us what do stem cells actually do?
Yes, sure. Thanks for having me again. I love that I get to be a frequent contributor to the Stem Cell Genius podcast.
Yeah. Are you the genius or?
Yeah, I'm not sure where maybe we should put a call out for an actual genius to come in.
You do know most of the answers. I'll give you that.
It's a very finite question list. So when it comes to what stem cells actually do, it's interesting because there's what we thought they did years ago, and now we know a lot more. So 15 years ago, there was sort of an answer that it would be very different than it is right now. So we used to think that when we give umbilical cord stem cells or any donor stem cells of the mesenchymal variety that, for instance, you would inject those into a patient's knee, and then those stem cells that we administered would turn into that person's cartilage cell. So effectively, they would get new DNA, right? They would become what's called a chimera and have 2 sets of DNA. We now know that that is not what happens, surprisingly, but that there's a whole different set of ways that stem cells do what they do.
Okay. Tell us about the set of what stem cells do.
Sure. So researchers have been looking at this for, over a decade now. And once we figured out that there's no engraftment, meaning the DNA doesn't become part of your DNA, we found that there are at least 6 different ways that stem cells act in the body, which is part and parcel of how you get new tissue repair and regeneration. Interestingly, as we age, the amount of stem cells that we have innately decreases.
And then really quick, just to verify, dumb it down for the rest of us, when you say it doesn't become part of our DNA, it means that we do not need to match up with the donor. It doesn't matter.
Well, that's not really exactly what it means. First of all, you don't need to match up because there's no rejection reaction. It's immunologically privileged. There's no MHC2 markers on the cells that we give. So your immune system doesn't look at it as foreign and say, we need to do a rejection reaction. It doesn't happen, which is why we've never had a rejection reaction.
Sure. That makes sense. I just wanted to clarify, I guess, for myself, too. A lot of different procedures out there, you kind of need to match up with a donor, maybe a kidney transplant or something like that. But that is not what we're talking about here. We don't need to go through that whole process.
Correct. As opposed to embryonic stem cells, the ones that come from aborted fetuses, yes, you would need to either be a match or, for instance, you would need to take immunosuppressive medications beforehand, which is a humongous hassle. So none of those treatments are clinically available. And by the way, if you're ever offered an embryonic stem cell treatment, turn around and run because they're not safe. They're not safe.
Why aren't they safe?
Well, embryonic stem cells do have MHC2 markers, so they do get rejected.
Okay,
and that could be potentially very dangerous, if not fatal type of response. The other problem with embryonic stem cells is they don't have a regular shutoff mechanism like mesenchymal stem cells, meaning that they can form tumors, and that's been shown in basic science and real life. There was a case study in 2016 of a person who went to Russia. He went to somewhere in South America and got embryonic stem cell procedures, and then he ended up with tumors throughout his spine.
Wow. Okay. Well, we definitely don't want that. All right. Well, I'll let you get back to the main topic. You said there were 6 different
There's at least 6.
Things.
I don't mind going down these rabbit holes. So let's go back out of this rabbit hole and back to the topic at hand. How do stem cells do what they do? Well, the scientific term for what I'm going to relay under the umbrella of how they work is called paracrine signaling. Paracrine is a scientific word that basically in this case means cell-to-cell signaling. All right. So the first thing that they do is dramatically reduce inflammation in wherever they get deposited. So for example, if someone gets an IV infusion of stem cells, then the stem cells will circulate through the body's bloodstream and they will seek out inflammation, and that's where they will deposit themselves.
Do we know why they seek out inflammation?
We don't. We just know that that was identified in a Harvard study about 20 years ago as to how they end up depositing. But there's got to be some kind of a signal that they receive and say, aha, this is the exit ramp. I need to go down.
Right.
And they don't all go down the same exit ramp. You know, you see stem cells in, for instance, a person who has diabetes. They're going to have inflammation. And, well, let's say it's uncontrolled diabetes. They're going to have inflammation in the pancreas, probably the kidney, other areas. So some stem cells are going to go to all those places. So to continue on, first thing they'll do is they get attracted by inflammation, but then they dramatically reduce that inflammation. So that's really one of the best things that stem cells do. Inflammation is good to a point, but with chronic low-grade inflammation, scientists call that inflammaging. It can be harmful. It can either create or exacerbate chronic diseases. It can make the diseases we have, worse, like with diabetes or a stroke or things that, you just want enough inflammation to help with healing. It's the first phase of healing.
Right. Well, I was going to say, we definitely need the inflammation in the first place, because otherwise where are the stem cells going to know where to go? They're not going to know. But it's nice that they also have the effect of reducing that inflammation at the same time.
Yep, stem cells are fantastic at that. Next thing that they do that are very good at is to create new blood flow. And the scientific term for that is angiogenesis, blood flow creation. And, as you know, blood flow is the main way that we get new oxygen, nutrition to damaged tissue. If you don't get it by blood flow, you have to get it by, diffusion or some other ineffective way. But this is the nice direct way. And that can help, repair nerve damage, help with tissue repair, like let's pick an organ, kidney, liver, heart. So it can be very, very effective in mitigating, some of the damage from the various diseases that we all suffer from.
Right.
Moving into the next benefit, they do something called anti-apoptosis. And apoptosis means cell death. And a lot of the cells that we have in our bodies have a pre-programmed date of death. And that means they live for a certain amount of time and then they're just gone.
Why do they have that pre-programmed?
I think it's just a way of basically killing them off before they start going awry on certain functions.
And are we constantly reproducing?
Yes, we have to. All the cells in our body, eventually die, and a lot of them have a pre-programmed date of death. And then if we're not producing enough behind those, then we're going to have a problem. So what mesenchymal stem cells have been shown to do is have a function called anti-apoptosis. So if you have a cartilage cell that's doing its function very nicely, do you really want it to die at that pre-programmed date of death? Or wouldn't it be nice to keep it around a little bit longer?
Right.
And that's what anti-apoptosis does, is it helps normally functioning cells stay around longer. And in a minute, I'll talk about the ratio of cellularity is what we'll call it, and how it can benefit. So we'll put that on the shelf for a second. Another one is immune modulation, immune system modulation. So if you let's look at two extremes. One is steroids. So if someone has, lung disease or whatnot, and a doctor says, let's just give a bunch of steroids every day to help mitigate the damage from the lung disease. Well, it's like dropping a bomb on a cockroach, one cockroach, right? It's a little bit extreme because there's so many side effects. There's so much collateral damage that you do with these steroids. For instance, you're going to suppress the adrenal system. You're going to cause water retention. You're going to cause weight gain. There's typically some insomnia or all these side effects that can cause long-term damage. You can get aseptic AVN, avascular necrosis of a joint, which is pretty much irreversible after a point. But these things are very harmful. And if you can find a drug or a biologic that has a much more surgical precision, as opposed to a bomb going off. And now let's look at a reaction in the body that's completely on the other end of the spectrum from COVID. So the COVID virus itself is very harmful. However, when the body reacted to the COVID response, they produced a cytokine storm. And the cytokine storm was a bunch of cytokines and interleukins and things like that were meant to help the situation, but that's not what they did. They actually harmed it, and it put a lot of patients into respiratory failure and on ventilator. So that is the immune system gone awry. So when you give mesenchymal stem cells, what it can help to do is to modulate the immune system in such a way that it's much more precise and there's a lot less collateral damage. And an example of that would be with an autoimmune disease, let's say psoriasis. I'm just picking one from the bucket. Or let's say rheumatoid arthritis. Actually, because rheumatoid arthritis is a lot worse than osteoarthritis, where the body's fighting against itself. So basically, you develop an antibody against the synovial tissue in joints, and it basically eats the synovial tissue, and it destroys the joints. Yeah. And then you get pain and disfigurement and whatnot. So wouldn't it be nice if instead of giving a methotrexate, for instance, which was a chemotherapy drug initially with all kinds of side effects, you could give something like mesenchymal stem cells and have it be much more precise with stopping that antibody destruction of the synovial tissue, right, and help with pain relief and help, prevent further degeneration of the body, but at the same time not have all those side effects.
Right.
In effect, it actually has collateral benefits instead of collateral damage, because mesenchymal stem cells have been shown to actually boost the rest of the immune system as opposed to damaging it.
Right.
And causing... And sometimes you open up the body to additional infections and things like that.
Right. Well, then you're taking more medications. I mean, you take one medication to help with something, but then that medication has 5 side effects, exactly. And you're now taking 6 medications, and in the end, it doesn't help. You end up needing a total knee replacement or whatever it might be, when, you can just come get yourself some stem cells and try and avoid
injections
that.
into joints. There have been some great studies over the last decade.
Yeah.
I have no idea why insurance companies still call it the, quote, gold standard, for joint arthritis. Mm-hmm. I mean, it is ridiculous. You give a steroid, patients get, maybe a few weeks of relief, and then it's actually worse than it was before. Steroids have been shown to damage cartilage. They've been shown to be deleterious and lead to a higher incidence of joint replacement.
Well, can't they just, they cause temporary relief, right? But, in the midst of that temporary relief, it's not actually healing the root problem. So it allows you to further injure or cause more inflammation for when that wears off. And then you need another one.
That's right. Yeah, exactly. So when I used to work at the VA in training, we would have veterans come in literally every 3 months. Mm-hmm. And we would give them, 2 or 3 joint injections with steroids and lidocaine. And that was like clockwork. Right. But when steroids were first approved by the FDA, the ubiquitous recommendation was you should only get 1 or maximum of 2 a year.
Oh, wow.
And, here we are, and
every 6 weeks.
Yeah, the doctors before us and the doctors after us, that was the routine.
Right.
Was to give 2 or 3 every 3 months. And it was just, in the long run, a terrible idea.
Yeah.
So getting back into the benefits, another one is anti-fibrosis. So fibrosis is the scientific word for scar tissue. Mm-hmm. So when you have something like pulmonary fibrosis, where you're continually getting scar tissue forming in the lungs, you want something that can help prevent scar tissue from forming, and mesenchymal stem cells are fantastic at that. So you can help prevent pulmonary fibrosis, for instance, from getting worse, and also help promote new cells to form and proliferate in the lungs, which leads me into the next benefit. But before I do that, let's talk about fibrosis in, another tissue, such as the kidney.
Sure.
So in the kidney, there's any number of things that can lead to kidney failure and scar tissue in the kidney. Unfortunately, it's not like the liver. The liver can regenerate itself nicely. Kidney doesn't do that. So if you have, worsening kidney failure and you're moving into stage 3, heading into stage 4, mesenchymal stem cells have been shown to help stop the formation of scar tissue, and they can help boost the function of the kidney. So nothing else has really been shown to do that to date. So it's a fantastic option. But if the kidney has significant scar tissue, it's not going to unscar that tissue, right?
Right.
So it's anti-fibrosis. It's not reverse fibrosis. You got to be realistic with what you're talking about. So moving into the next benefit, there is fantastic paracrine signaling. Once again, that's the cell-to-cell signaling to help call in cells that the area needs. And that's called chemotaxis.
Wow, that's some really cool stuff for sure.
It is, fascinating when as we learn that it wasn't necessarily the stem cells being given that turn into your necessary cartilage or kidney cells. Years ago, Dr. Arnold Kaplan, who is the father of modern regenerative medicine, and he's the one that actually named mesenchymal stem cells. MSC and that was back in the 1980s and 90s is when those studies at his laboratory were being done. He came back with another article about 8 years ago and decided that it was time to change the name. He kept the moniker MSC, but he wanted to call them medicinal signaling cells. As to why, he says that when he named MSCs mesenchymal stem cells, he did it really to appease the orthopedic community because it was a well-known term, and that was kind of what he went with. Since then, other names have popped up using MSC, such as mesenchymal stromal cell, multipotent stromal cell, marrow stromal cell. They all mean the same thing. But at this point, and the reason he wanted to change it to that is because as we found out that it's not the stem cells being given that turn into your specialty cell, he wanted it to be understood that it's not a curative type of situation. You give these mesenchymal stem cells, medicinal signaling cells, and they secrete these bioactive factors. What are those? There's a lot of cytokines, there's growth factors, there's exosomes, interleukins, all these scientific terms that mean various proteins, basically.
Sure.
And they stimulate activities either in the local area where they are, or they send out signals to bring in the necessary components to create new tissue for repair.
That's pretty cool. I kind of like that he kept the MSC, through all of the different names, even if it wasn't going to be mesenchymal stem cells. He kind of kept that. I really like the medicinal one. Maybe we should consider changing ours to that. What do you think?
Well, he, in addition to medicinal signaling cells, in the article, he says, maybe there's other options. I'll read the list here. Okay. Magic signaling cells.
Okay.
More strategic cells. Maxi secreting cells. Most sensitive cells. I don't like that one. Main secreting cells or message secreting cells. Mm-hmm. So he just started, spitballing various ideas.
Yeah, absolutely.
Of things that stuck with the MSC.
The magic one. I don't know. That's kind of sticking.
Yeah, God rest his soul. He passed away last year. Very sweet, very, very knowledgeable individual. He brought so much to the field. He's a nice guy. I watched him speak a couple times, talked to him. He gave us some advice, and I agree with him. Now that we know what is really happening or not happening, I think it is time to change the way we think about it.
Right.
So, and I think it gives more credibility to the fact that, we don't use autologous stem cells much anymore at our clinics because the umbilical cord stem cells, the signals that they secrete are just so powerful rather than the ones that we've been living with for decades.
So can you clarify, is mesenchymal just a type of cell in general? It's not always associated with umbilical?
Right, exactly. So
Okay.
even the cells that you get from your fat tissue or some of the ones that we get from bone marrow, our own bone marrow, are mesenchymal stem cells too.
Yeah, I definitely think it's time we give it a change and kind of classify it as its own. And we all know now that they're associated with umbilical, maybe. And, maybe that's what we do and kind of keep that MSC. It's cool that you spoke with him. I didn't know that.
Yeah, he used to speak every year at a meeting in Orange County. And we would go for the day. And one day I didn't see him on the agenda, but he spoke. Nice guy. Very down to earth. A lot of scientists are sort of up in the sky.
Sure.
It's like, dude, what are you talking about?
Yeah.
They can't relate, to people around them. It's a blessing and a curse, right? They're so smart that they give all these gifts to us, but then they can't actually have interpersonal conversations. He was both.
He was both.
Yeah.
He was special. He was magic.
He was a magic signaling person.
An MSP.
Yeah.
Some cool stuff. I love it. Well, let's kind of bring it back to talking about the top 5 conditions that we do treat. So I'm going to start with arthritis. I know that's our number 1 condition we treat. So tell me how stem cells actually play a role.
So yeah, it's by far the number 1, issue that we deal with at our clinics. And it's interesting because when people have arthritis in one joint, they typically have it in multiple, and so we'll usually help them with all of them. Arthritis, there's about 100 different types. So we're just going to talk right now predominantly about osteoarthritis, which is good old wear and tear, degenerative arthritis. So the way I think of osteoarthritis when it comes to regenerative therapies is as a roller coaster. So when you're younger, you make cartilage at a certain rate and you lose it at pretty much the same rate. So you're sort of going up the roller coaster in the middle before you get to the, big drop.
Right.
And you make cartilage, you lose it. There's like what you would call a homeostasis, right? An equality. And you don't have pain, right? So, but as we get older, the science shows that you still continue to make cartilage at the same rate, but you start to lose it faster.
I see.
So you're going down the roller coaster.
Right.
Right? And as you get towards the abyss of the roller coaster, that's when a lot of people start having pain. And, they play golf and they hurt for the next 3 days, or, they sit in a movie theater and they have trouble getting up after, an hour and a half or whatnot. It's pretty much very, very similar stories that we hear. So then what happens is people say, oh, well, you're going to give me an injection in my knee and I'm cured, right? That's going to fix my cartilage. And well, that is not the way it works. I wish it was.
Right.
But what happens is you get these injections of regenerative biologics, and we typically inject medicinal signaling cells, plus magic signaling cells, plus PRP to help as a scaffold for creating new tissue. And it also has platelets and growth factors and, bioactive. So when you put these together, you do get new cartilage formation, new synovial tissue, and you get cushioning as well in the joint. There is hyaluronic acid in the stem cell biologic, which is the motor oil of our joints. So it helps a lot with pain relief. And whereas steroids might help for a few weeks, the MSCs and the PRP typically help for anywhere from 1 year. We've seen it work for 3, 4, 5 years in certain individuals. So it is a fantastic therapy. It's a fantastic outcome for the vast majority of folks, but it's not a cure. So the way I look at it is we are changing ratios. You're starting out equal when you're younger, then you start to lose cartilage faster. When you get the biologic, you start to make cartilage faster and you lose less. So now we're going back up the roller coaster.
Right.
And people are like, okay, well, that's it, right? I don't ever need the treatment again. No, eventually you're going to reach the top of the roller coaster and start to come back down again, which is why, but think about it. If you need a treatment every 2 to 3 years, isn't that better than undergoing surgery with the potential risks involved with that?
Right.
So arthritis is our most common treatment. Thankfully, patients do unbelievably well, and it's been fantastic.
Yeah. You'd actually brought up something that I also wanted to clarify, which is growth factors. We say growth factors all the time. We know that they must be good. What are growth factors?
Well, I don't want to delve too much into the weeds on it because I think we'd probably have a big drop off in our listenership. But if, if you look at what growth factors are, I mean, there's just in the stem cell biologics that we administer, there's over 40 different types of growth. I mean, there's probably more like closer to 75. But as far as what we've identified, and they're proteins. All right, they're not cells. They don't replicate like a cell would, but and in and of themselves, they don't have a specific function. But what they do is they attach to cells, or maybe they get eaten by cells, and it's what they induce to happen. They induce transcription of new DNA, transcription of new proteins. Basically, they induce trophic growth of tissue for repair and regeneration. So they are a stimulus, basically. They're like a foreman of a construction site that says, okay, you put the barbed wire fence up. You make the concrete, whatever the foreman is doing.
Sure. Pretty cool. Thank you for clarifying. I'll move on to our second most common condition that we treat, which is back pain.
Yeah, so back pain is incredibly common. 25% of our patients in every country we're in present with back pain. And it might be back pain by itself, which is located just in the back, called axial back pain, or it may also go down the legs, which a lot of people call sciatica. And that could be from a herniated disc. It could be from what's called spinal stenosis or, what have you. So thankfully, we have fantastic treatment option for back pain. And we developed this years ago with what we call the regenerative trifecta. And we trademarked that term. And it's the trifecta. It's not a horse bet. It's a... although we've put a lot of bets into this and it's paid off for our patients tremendously. And it's a proprietary combination of mesenchymal stem cells, exosomes, and PRP. And the combination produces unreal pain relief for patients, whether they're trying to avoid surgery, whether they've had back surgery and didn't get the relief they wanted, or they've had failed back surgery with scar tissue or whatnot. It just helps with all of that. A lot of pain management doctors or others will say, you know what, I think your pain is coming from the L4-5 facet joint on the right. And that's what they go after. And the patient's like, well, that helped from like maybe 10%. That's ridiculous. Mm-hmm. If you have arthritis in one of your joints in the back, you've probably got it in like 3 or 4, right? Mm-hmm. It's pretty diffuse with how it presents. So we approach it differently. We approach it with let's flood the back with the regenerative biologics. And that's why we get much better outcomes than those, let's going after like one facet. Some of that's dictated by insurance. They'll say, well, I only get paid for this one joint and then come back in 2 weeks and I'll do the next one. That's
And
insane.
They're not MSCs.
No, they're just steroids.
Right. Well, that's the beauty of MSCs too, though. I mean, even if we did flood one area of the back, if there truly is enough inflammation, guess what? They're going to go there.
Yeah, they home in to where the inflammation is.
Right.
And studies have shown that MSCs in the paraspinal muscles stay there for months. 3, 4, 5 months, and they slowly leach into the surrounding inflammation and continue to relieve that and repair the damage.
Yeah, it's a beautiful thing if you think about it. I mean, I love seeing these success stories and speaking with these patients that are coming back for their second, third, fourth procedures, and they've been with us for so long because they've seen so many great results. Or maybe they see, 60% improvement and they say, oh my gosh, clearly I take the stem cells, I'm going to come back.
Yeah, like Nick from, you and I were at the Mexico clinic last week. Nick from Seattle was a gentleman who was coming back. He had his shoulders, his back, and
knees
injected a year and a half before. 90% improved.
Right.
And he said he was just coming down for a top off, is the way he put it, for his back.
Right.
He still had a little pain. So that was all he really wanted to get done. But to hear someone say they have 90% relief, he wasn't taking any of the hardcore medications he was taking before. He was back at work full time, playing with his, adolescent kids. And he just seemed much happier.
Yeah.
He was telling us he's much happier.
Yeah. No, I'm so glad we ran into Nick.
Yeah.
We weren't even planning on seeing him.
No. We went to see the autistic children treatment, and he was on the van with us.
Yeah. It's always fun seeing the patients on the van crossing the border. Why are you here? It's cool. Well, that brings me into the number 3 condition, diabetes type 1 and 2. And I just want to preface the amount of people I've spoken to that have seen great results who are diabetic is insane. I was speaking with a doctor just about a month ago, and 2 weeks after his first IV treatment, he cut his daily dose of insulin in half. I mean, it's crazy. 2 weeks.
I mean, that's the definition of a high responder, right?
Right.
Within 2 weeks.
It is.
Because usually it might take 4 to 6 weeks to start to really.
One
and we
healing
actually,
cycle's
our
a
research
little
team, we wrote a paper on this last year. I'm actually going to post on our website all the 10 papers we've written over the last 2 years, because they're free to download and read. The beauty of stem cells for, let's say, type 2 diabetes, that's the type you have to earn it, right?
Oh, gosh.
It's not the type it's not genetic, right?
I don't know if earn is the right word. It's like a prize.
Right. No, it's the wrong type of consolational prize. But, it's not just having high blood sugars. It's everything that comes along with those high blood sugars, neuropathy, erectile dysfunction, kidney failure, maybe heart disease, retinopathy of the eyes. But what we showed in that paper is we pooled together lots of clinical trial data on stem cells for diabetes. And we showed that not only does it regulate blood sugars better and helps reduce the amount of insulin patients need, sometimes eliminates the insulin, but it also reduced dramatically the secondary complications of diabetes, because we were able to evaluate side by side people in these trials who had the diabetes, stem cells for diabetes, and those who got, placebo.
Right.
And it was dramatic. I mean, it was way statistically significant. So we've elucidated pretty well over the years how stem cells work for type 2 diabetes. And there's 2 problems with type 2 diabetes. One is you're not making enough insulin, and the insulin that you do make, the cells in your body have become pretty resistant to the insulin. So you're not uptaking the glucose and your blood sugars are high. So when we look at how the mesenchymal stem cells work for type 2 diabetes, they work on both sides of the equation. One is they help you produce more insulin, but they also work on the more important part, which is helping to make your cells more susceptible to the insulin that you are making. So in addition to, some lifestyle improvements / modifications, people make tremendous improvements with everything. The ED, the neuropathy improves. They can help prevent a lot of those secondary complications from becoming reality.
I'm surprised that it's only number 3.
I know.
When you think about it.
Well, that was more of an umbrella with the diabetes.
Right. It hits a lot.
Because we have,
different
not only for diabetes with giving the stem cells IV infusion, but we also, there's various protocols we have for like neuropathy or the ED.
We have a neuropathy protocol.
Yeah, the add-ons too.
Right.
And that's one of the differences between us and a lot of other clinics is that over the last 13 years, 26,000 procedures, we've developed these amazing best practice protocols based on our experience and the peer-reviewed research data.
Yeah, absolutely. And the cool thing is that we're so consistent. I mean, we have an in-house lab,
Yeah, exactly.
We're so consistent. It's great. All right, well, let's talk about the 4th one, autoimmune conditions. It's a big one. It's a big umbrella, for sure.
Yeah, it is. So when you look at autoimmune, you can say they're all the same, but they're not. But the reason they're umbrellaed together is because it's the body fighting against itself.
Right.
So whether you're talking about systemic sclerosis, scleroderma, psoriasis, lupus, RA, you're really talking about a different problem under the same umbrella of the body fighting against itself. So earlier we talked about rheumatoid arthritis, but really when you look at our consumer guides that I wrote, there's one on RA, there's one on psoriasis, there's one on SLE. The results have been stellar, but it's not 100%. But here's one of the bigger problems is that when you look at traditional medicine, either the doctor is dropping the bomb on the situation, like methotrexate, which was initially a chemotherapy drug for RA, where you have all these collateral damage, or they're putting steroids over the situation, which is also a blanket immunosuppressive problem creating drug, or they're trying one of these newer biologics that have been FDA approved, and 50% of people can't tolerate the side effects. So, whatever the commercials are on TV, Skyrizi or whatever they sound great, but a lot of people just can't tolerate them.
Yeah.
So when you look at the results with stem cell therapy, in most of these studies, and I'm not going to make a complete blanket statement, but in most of them, at least half of people are able to get into full remission with mesenchymal stem cell therapy for these autoimmune disorders. And if it's not full remission, it's maybe 30 to 40% remission. I mean, it's really good results with the medications that they were using. They can drop dramatically.
Yeah, absolutely. I mean, if I was, suffering in one of the several conditions that you just mentioned, I mean, even with a 10 or 15% improvement, I would take it. I mean, that's a big section of your life right there.
Yeah, if you look at the RA consumer guide, in there's a nice study, very well done, double-blinded, randomized, and the ones that went into remission, which was about half of the patients who got the mesenchymal stem cells, they were in remission for 3 years.
Wow. And then what, just need a re-up in 3 years?
Yeah, they just needed a re-up.
A re-up, as I say.
yeah, exactly. Repeat. There you go.
A repeat. Yeah. I like re-up better.
Top off, re-up.
Yeah. Okay, cool. And then that brings me to our last of the top 5 conditions, which is ASD.
So ASD is, I get excited just thinking about it because I just picture some of the kids we've treated and, how much better they've gotten.
Oh, this past weekend in Tijuana, I mean, I was touched the entire time, spending time with these families. And, it was their second or third procedure with MSCs. And, I mean, the improvement is wild. It really is.
It is, because not just, first of all, the parents know because they're around these children all the time.
Right.
They know them better than anyone. But when you start hearing it from third parties, like their teachers,
right,
and the other doctors that they see for speech therapy and behavioral therapy, it makes it all the more impressive with the speech, the communication abilities. But just, when a child walks up to his mom and out of the blue says, "I love you," and they've never said that before, and it wasn't like they were just watching YouTube and repeated it.
Right.
And then better eye contact, attention span. They can go to a regular school as opposed to what they've being kept apart for years. It's touching. It really is.
Yeah. I absolutely had so much fun this past weekend in Tijuana with the families. And, I feel like children with autism can sense when they feel safety, right? And it was so nice feeling like the children were bonding with us the entire time too. And I don't know if that would have been capable. I mean, it's a spectrum, right? Everybody reacts differently, but I don't know, without the first 1 or 2 treatments that they've gotten, if, they would have reacted that way with us. You never know. And it's so wild. It really is.
I was bonding too with TJ. We were hanging out with our feet in the water and whatnot. And then he threw my glasses in the pool.
He did. And he got his pants in the pool. That was the second pair of pants of the night because of the pool. And he said, "Oh, here's glasses." And they're going in the pool. But he felt so badly, though. That's the thing.
Did he?
I think he took a look at them. He either felt badly or he wished he could throw them again.
Yeah, that's right. right.
Maybe
Exactly.
he was trying to get them a little farther.
He wanted to get some more airtime. Yeah. That's funny. I'm like, I don't know what to do. I don't know if my arm is long enough.
I know, you look at me, I go, you're going to fall in. Like, that's a solid 3 to 4 feet.
But when you look at autism and how the stem cells work, first of all, we don't even know exactly what causes ASD.
Right.
We do know that functional MRIs and other, diagnostic modalities do show what appears to be more inflammation in the brain, central nervous system of these children. Others have more wild theories about various pathogens or whatnot, but I think ubiquitously the neuroinflammation is a leader of what we think. So when you give the regenerative biologics, the exosomes and the stem cells, which are fantastic at reducing that inflammation, in my thought process, it becomes a fantastic time to create these new neural networks because the inflammation, the oxidative stress, the reactive oxygen species, it's not gone, but it's we really, really brought down to a much more manageable level, and it frees up your own innate processes to develop these new neural networks. So when Paul, the father of TJ, tells me that not only did they get good results initially, but it continued to get better for months and months with the speech and behavioral therapies, and they had reached a brick wall before.
Right.
But they were pummeling through that brick wall like Mr. Kool-Aid,
Yeah.
way down the road with improvements. And that is exactly the way I think about it, is that you've basically paved the yellow brick road for them to get more and more improvements.
Right.
With the way that it works in the central nervous system.
Yeah. I was even talking to Adriana, the mother of Victor, the other child that we met. And she was saying, we're going to take a break for the summer. We're going to learn ASL. And I said, this is such a great time to do that because we're going to create the new Neurolinks right after this procedure. And it's the best time for him to kind of soak all of that in. It's his break from school and, all of his different therapies and Adriana herself, she does work with children. So she's the perfect person to work with him. But, we were saying the same thing and she completely agreed too.
Yeah. I mean, if you look at the way that it works, we typically see a lot of improvement starting at about the 4th week or so on average.
Right.
And they continue to get better and better for months.
Right.
And then, somewhere around 6 to 9 months, it pretty much baselines. Most of the improvements are theirs to keep. However, as with TJ, the one boy that we were hanging out with, he did regress a little bit with what his father described as, quote, irritability. Otherwise, he kept all of his improvements. So it's hard to give parents in black and white terms what improvements they're going to see and whether all of them are going to be retained or there might be a little bit of regression.
Right.
But overall, changing lives, kids are doing fantastic. And,
yeah, absolutely.
And, one thing with us is we do use sedation.
Right. I was just about to say, for the parents listening right now, how do we treat these children so they know what maybe their child's in store for?
It's so at our Mexico locations, we're putting in separate areas for the families because I noticed, and this is parents of autistic children, you shouldn't feel this way. It seemed like they were embarrassed that their children were, a little bit loud during the treatment or whatnot. I mean, this is part and parcel of what it is. Nobody should be embarrassed about, getting the treatment that is going to help. And nobody, I think it's really just themselves, just the nature of who they are. But at any rate, we're putting in separate areas for after the treatment for them to relax and almost like hotel rooms in the facilities. Yeah. And we actually have a hotel at our Philippines clinic
right there,
right in the building.
So nice.
It's awesome.
And, and we were even talking about throwing around the idea of having some toys, in these rooms and, other fun things for children.
During the treatment, our anesthesiologists are very, very highly skilled. They do these every week. And basically, in Mexico, we use gas, the anesthetic gas. It's a mask. So they don't even have to get the IV stick first. They get the anesthetic gas, and I think it was like 30 seconds. They were relaxed, and so they kind of a lot of them fell asleep. But it's not general anesthesia. We do full monitoring, pulse, heart rate, oxygen saturation, and then they are able to get the IV. We're able to do the intrathecal. All that takes maybe 15 minutes.
So tell us what's intrathecal.
So intrathecal is, so the child is just kind of flat, laying on their back. They get the 30 seconds of the gas to get going. Then they don't remember anything and they don't feel any pain. But the IV gets started. We have an IV specialist nurse, and they start the drip for the multivitamin, and then just some saline. So then the child's sort of rolled onto his or her side so that the back is exposed, and they do a sterile preparation. And basically, it's a reverse spinal tap. A parent can be in the room, and you can see how it's done, but it's fast. I mean, these anesthesiologists do this. They do spinal taps all week long in the hospital and stuff. And so it's fast. And it's just a couple cc's, which could be 50 million stem cells injected, and then a nice bandage. And then
it's injected into the spine.
It's injected into the spinal cord, yeah. And then they also, while that's happening, they're doing the IV with some of the stem cells and exosomes as well. Yeah. So it's fast. That whole being under conscious sedation is less than 30 minutes.
Right. I mean, I don't even know if it lasted that long for both Victor and TJ this past weekend.
I know. Yeah.
They were super quick. They know what they're doing for sure.
They really do. The anesthesiologist kind of went in. They saw a little drop of the CSF coming back. They know exactly where they are. And then she injected the 2 cc's very slowly. And, he had no side effects. And then she pulled that one out. And then they just let the IV drip finish. And bada bing, bada boom, he woke up within 5 minutes. They just let the gas wear off.
Yeah, nice and easy. Yeah, you got to travel there. Yeah, you got to do this, you got to do that. But, isn't it all worth it in the end to see that improvement?
It is. You hit those brick walls with the traditional treatments. And we hear this all over the world. I mean, the stories are very, very similar as far as what they've tried. Mm-hmm. And this is a way to break through that brick wall.
Yeah. Absolutely. I recommend it. It didn't look too bad. I stood in the room. So did you.
I did, yeah.
Yeah, wasn't bad. Nice and easy, calm setting. Cool. I think it'll be better when we have those recovery rooms for sure.
Yeah, they're in the same, in Tijuana, they're in the same building. In Cancun, they're actually in the same. We have a huge office in Cancun. Yeah. It's a few thousand square feet. So there's separate rooms that we've sort of cordoned off that are going to be specifically for ASD children and their parents.
Wonderful. I love it. I'm sure they will too.
Yep, they will. They will.
Anything else you'd like to add, Dr. Green?
No, I think we spent a lot of good time talking about how the stem cells work, going through specific conditions. We've been in this business a long time. We got a lot of locations. We'd love to help individuals and their families. So check us out online at r3stemcell.com, and I'm sure you'll finish up.
And give us a call at +1 844-GET-STEM to see if you or a loved one are a candidate.
Thank you for having me.
You're absolutely welcome.
Stem cell therapy is considered experimental and is regulated by the U.S. Food and Drug Administration, but is not FDA approved. R3 Stem Cell does not offer stem cell therapy as a cure for any medical condition. No statements made on this podcast have been evaluated or approved by the FDA. This podcast does not provide medical advice. All content is for informational purposes only and is not a substitute for professional medical consultations, diagnosis, or treatment. Reliance on any information provided by R3 Stem Cell, its employees, others appearing on this podcast at the invitation of R3 Stem Cell, or other visitors on this podcast is solely at your own risk. R3 Stem Cell does not recommend or endorse any specific tests, products, procedures, opinions, or other information that may be mentioned on this podcast. R3 Stem Cell is not responsible for the outcome of your procedure. The FDA considers stem cell therapy experimental at this point.